Welcome to the Alberta Dental Association and College Reprocessing Learning Module 1. In all dental clinics, it's critical to prevent the transmission of disease caused by microorganisms found on used dental devices. The 3 modules in our learning series outline the proper procedures to follow to correctly reprocess used dental devices so they're safe for reuse. Infection prevention and control practices are aimed at controlling the transmission of infectious diseases. At the core of infection prevention and control is the chain of infection. For an infection to occur, all links in the chain must remain intact. A break in the chain will interrupt the transmission of infections. In the dental office setting, the easiest way to break the chain is to eliminate the reservoirs and interrupt the mode of transmission. Common reservoirs found in dental offices are humans and the environment. Devices used to provide dental care act as environmental reservoirs. Adherence to reprocessing standards will ensure this link is broken. Reprocessing is a sequence of steps performed to prepare a used dental device for reuse. These steps include meticulous cleaning, drying, inspection, packaging or wrapping of critical dental devices to be sterilized, disinfection or sterilization, and the proper storage of clean and sterile instruments. The level of reprocessing required for a dental device depends on its intended use and risk of the device spreading an infection and can be broken down into 3 categories. Critical devices are those that penetrate soft tissue, contact bone, or contact the bloodstream or any other normally sterile body tissue. Examples include surgical instruments, periodontal scalers, and dental burrs. Critical devices require cleaning and sterilization. Semi-critical devices are those that contact mucous membranes or non-intact skin, but do not penetrate soft tissue, contact bone, enter into or contact the bloodstream or other normally sterile tissues. Examples include dental examination mirrors, rubber dam frames, rubber dam forceps, and reusable impression trays. All heat-tolerant semi-critical dental devices should be cleaned and sterilized. Heat-intolerant semi-critical dental devices require cleaning and high-level disinfection at a minimum. It is recommended that single-use disposable items be used instead of heat-intolerant semi-critical dental devices. Non-critical dental devices are those that contact intact skin. Examples include face bows and rubber dam punches. Non-critical dental devices require cleaning followed by low-level disinfection. This is a 2-step process. One-way workflow is the process of ensuring that reprocessing work flows in one direction, from the dirtiest task to the cleanest task, in order to prevent cross-contamination. A typical workflow would include receiving and cleaning soiled devices, drying, inspection, the preparation and packaging of devices for sterilization, sterilization itself, and finally, the proper handling and storage of clean and sterile devices. Physical separation of areas used for dirty and clean tasks is ideal, but may not be possible. When physical separation is not possible, it's imperative that reprocessing staff understand one-way workflow and be able to demonstrate functional separation of reprocessing steps. To help aid you in correctly performing reprocessing procedures, each office must have an office-specific reprocessing procedure manual detailing how reprocessing should be conducted in your clinic. One person should be designated to oversee the development and implementation of this document within the clinic, but the ultimate responsibility rests with the principal dentist. Office-specific reprocessing procedures should be written in a step-by-step manner so that a new staff person would be able to reprocess devices by referencing the manual. Staff working in any healthcare setting, including dental offices, must follow routine infection prevention and control practices to protect themselves and others from transmission of infection. Specific practices must be developed for each office. Written policies must include procedures which prevent worker exposure to body substances and prevent injuries from sharp objects. They must also include specific procedures which provide direction if a worker sustains a potential exposure to blood-borne pathogens, such as HIV, hepatitis B or C, via injury with a contaminated sharp object or a splash to unprotected mucous membrane or non-intact skin. Whenever involved in activities that have the potential to generate splashes or aerosols, it's important for staff to protect themselves. This is accomplished by the use of personal protective equipment, or PPE. Anyone involved in the reprocessing of dental devices should be aware of what PPE to wear during reprocessing, as well as correct procedures for putting on and removing PPE. For instance, there shall be a designated area for putting on and removing PPE. Storage of clean PPE should be in an area protected from contamination. All PPE, including masks, are single use. Any reusable personal protective equipment must be laundered or cleaned and disinfected between uses. This means there must be a collection or disposal container for used PPE where it is removed. PPE must be appropriate for the tasks it'll be used for. PPE used in reprocessing has specific requirements that must be considered when being selected. For instance, gowns should be moisture impervious, cover the arms, and fasten at the back. They must be either discarded if disposable or laundered if reusable after each use. Face protection is required whenever there's a risk of splashes or aerosolization. This is most likely to occur during manual cleaning and rinsing of devices. Face protection must provide protection of mucous membranes of the mouth, nose, and eyes. This can be accomplished by using a full face shield or safety glasses or goggles with side protection, and a single-use fluid impervious mask may also be used. Note that personal eyewear provides insufficient protection and is not considered eye protection. Procedure or examination gloves provide insufficient protection and are not suitable for handling soiled devices or chemicals in the reprocessing area. Gloves used in reprocessing must be chemical and tear resistant with a cuff that extends up the forearm. Gloves selected for use can be single-use disposable or they can be reusable. If reusable gloves are selected, they must be used by only one person, and a method of labeling them must be developed. Decontamination of reusable gloves must occur after each use. They need to be washed and disinfected. Reusable gloves must be stored in a manner that will allow them to dry between uses. They must be worn only when handling contaminated devices in the dirty area. Care in the putting on and removal of PPE is critical, as PPE can contaminate the person who's wearing it. A critical component in the correct use of PPE includes hand hygiene before putting on PPE and during its removal. These steps should be reviewed with staff on a regular basis. Gloves must be inspected for evidence of holes or deterioration, such as tears and punctures, every time they're used. If gloves are not intact, they must be discarded. Now that you're aware of the proper PPE you should be wearing and have an overview of the reprocessing process, please proceed to Module 2, where you'll learn about the proper procedures for cleaning and preparing instruments for sterilization. Thanks for watching.